We have time for questions now. First, let's take questions from the committee for either Dr. Pine or Dr. Craig. Please use your microphones.
This sent in via WebEx. It says, great presentation, Dr. Pine. How do you measure being bullied in the scanner, and do you manipulate power imbalance? It's from Tracy Betancourt.
Yeah, so the question was about how we measure bullying in the scanner. So I'll do a brief version of it. And again, Johanna Jarko is my postdoc who developed this work. We have a virtual classroom that we created. It involves deception. The entire study involves deception, and we do this kind of hand in hand with the IRB at the NIH, where Dave Wendler is an expert on research in deception with children. So children are deceived to believe that they're going to be new kids in a school, and they interact with kids that they learn have different reputations. So there are some kids who have reputations for being mean. There's some kids who have reputations for being nice, and there are other kids who have reputations for being unpredictable. So power is manipulated to the extent that kids, when they go into the scanner, understand that there are kids with different reputations in terms of how they tend to behave. The way the task works is that kids fill out a number of materials about themselves, kind of background material, and the computer uses those material to construct feedback that's given by these different, quote, peers. You know, again, they're virtual avatars. And in the key events that are bullying-like, one of the avatars, I'm kind of wincing as I say it because I'm frequently the person on and I see this. They'll say things like, I remember one avatar saying to this kid in the scanner, you like Justin Bieber, that's lame. That's an example of the kind of things that they do or they say. And if you're interested in kind of seeing the graphics, we do have a paper on the paradigm. It's Johanna Jarko, G-A-R-C-H-O, is the first author, and I'm one of the authors on it. And you can see the graphics on it. Probably the most relevant work we've done is with Nathan Fox, and the studies, or these data aren't published yet, but they show that kids with certain kinds of temperament associated with fear and anxiety and avoidance have particularly potent responses to these kinds of events when they've been recently exposed to classroom bullying. I will say, after talking about all of this, I do think that all of this research, including the stuff that I'm describing right now, it is very, very early. And I do think for an IOM committee, I think you probably want to spend, or at least my advice would be, to spend more time and energy on method and paradigm development rather than application, because I don't think any of these methods, including the ones that I spend all my time on, are ready for answering fundamental public health questions. The methods are just not sufficiently robust or understood yet.
Thank you. Okay, other questions from the panel? Introduce yourself, sir.
Matt Masiello, thank you. Wrong button. Your last point was the most interesting, Danny, in that potentially we're not ready yet to provide this information to a public health model. However, our health providers are out there looking for more information, and this is, the neurobiological information that we're presenting today is fabulous. We continue to look for information that sparks the interest of these providers that will get them involved in the topic. As a practitioner and someone involved in the research of bullying prevention from a public health perspective, I find this very interesting. So my question is, what can we get out there, and when can we do it?
For me, the kinds of things that I find more convincing are established measures like C-reactive protein or telomere shortening. Those are measures where we kind of really know what they mean, and they do have real-world public health impact. So I think you're on much, even cortisol, quite honestly, although we know a lot less about the significance of that. So I would lean much more on measures like C-reactive protein.
May I just ask Dr. Craig to follow up with a comment on that as well? Thank you.
Yeah, I agree with the previous comments that this is very new research, and it's an area that needs to be further developed. But I think it's important message to get out there that we're finding these relationships that relate to this behavioral phenomenon, and I think it's a way to help people understand where these impacts are. And in some of the work that's been done, when I think about the hormone work, it's really showed that this is one of the pathways or the iterative or transactional ways that leads to some of these mental health problems. I also think that, that relationship that's being shown is important, and I agree there are methodological things that need to be sorted out, but I think that there's a growing body of work that's supporting this. I also think with respect to the fMRI work, in some of the tasks, like the cyberball task, it's a pretty robust finding, and there's a review paper that recently came out that talks about the variety of studies. So while I think it's new, I think we have to refine our methods. I think we have to get better at it. I also think that this is an important public health message to send. I think it is an important idea to recognize and acknowledge the role of these neurobiological, or to consider them so that we can understand the impact. And I also think it's a way of engaging the public around the seriousness and the significance of this type of issue, and particularly teachers. So when I go back to one of the findings from the ERP findings is kids react to seeing social exclusion through the ERP studies within 500 milliseconds. That's an automatic response that says to me that information is being processed really quickly, and that has meaning in terms of how kids interact and how we interact with kids and what happens to them, for example, when they've seen at least 2 episodes of bullying on the playground and they come inside and then start to be at school. So we're not ready to generalize to those yet, but I think thinking about these as seeds are really important, and we have to acknowledge the role of this.
Mark?
I have a question for Dr. Pine.
Again, introduce yourself.
Oh, sorry, Mark Hatzenbuehler from Columbia. Thanks for a great talk. I was wondering if you could talk a little bit more about the twin studies showing the strong heritability of bullying. And my concern a little bit is the messaging of some of those studies in terms of further sort of blaming the victims and putting the onus on them, particularly where we know that there's so many marginalized groups that are disproportionate risk of bullying. It can further sort of exacerbate stigma against those groups. So I'm just wondering if you could talk a little bit more about, because I know there have been some findings in other literature around trauma and victimization showing similar heritability, and sort of just messaging of that, and really the utility of some of those twin studies versus, I think, some of the work on fMRI and other work showing some of the biological consequences of bullying that seems to not have some of those potential pitfalls.
Yeah, so I was telling Regina, I'm not a great one for messaging, so I don't know. I tend to be very kind of stick to the data, so I'll give some comments about that. I do think you're completely right. I think that it's very easy for a lot of the stuff that we're talking about to be misused. And not to say too much about the fMRI, but I do think it's every bit as true for the fMRI as it is for the twin studies. I think what I would probably do in messaging and thinking about this is that there have been a lot of people who have already struggled with how to bring forward messages about complex behaviors in terms of the role of genes in the environment, and I would try to learn from those lessons. I think on the one hand, it would clearly be wrong to emphasize either one of those factors, genetics or the environment, because obviously both are important. And I do think there is a very big risk of blaming the victim here, and I think you want to acknowledge that right out at the start. On the one hand, on the other hand, twin studies do kind of establish a general sense of how important genetics are at a global level for a relevant phenomenon. So I think it would be a mistake to ignore the fact that the best twin study says that this problem involves a substantial component from genes, with all the usual kinds of cautions that go with that. So I'm glad that I don't have to do that. I think compared to other behaviors that we examine, particularly the kinds of behaviors that I examine, anxiety, the contribution of genetics is stronger for the phenomena that you're examining. So, I think it would be a mistake to not grapple with that.
So thank you for two really wonderful talks. So Dr. Craig, I have a question for you. I guess I have a comment and then a question. So at the very least, we know that the brain is changing with bullying. The data suggests that. And it's, on some level, it's not so surprising because the brain is the organ of behavior. So whenever we have a behavior, our brain is going to change. And I just want to make a statement here about a child's behavior in pain should be sufficient to let us help that child. Right. Yes, so I think everybody agrees that. So, and I think that sometimes people take neuroscience data and they think it's real. But we know what a child is feeling without the neuroscience. So how can this neuroscience help us deal with the child at that moment? So I think that on one level, we know that the data is converging, that it's impacting the limbic system, or we know it's important in threat responding and emotional responses. So that does tell us something a little bit more about how that processing is occurring. Do you agree so far? So, what intrigues me, so I think that's the big message here for me, and I'd love comments about that. So the second big message for me is the long-term. Yeah.
One thing I'd say is I think that's everything you said is correct, and it's particularly true about the victim.
Yeah, the victim.
It may not apply as fully to the bully.
Right, you're absolutely right. So let me just stick with the victim for a minute. So the other thing that intrigues me about the neuroscience data, and I'm saying this as a neuroscientist, I just want to put this data in perspective. The other thing is the long-term outcome, and finding those changes in the brain suggests to me that there is some great overlap with trauma and early life child abuse. So this is real changes that are occurring in the brain that we know from many, many studies are going to produce a vulnerability to many other problems in life. In terms of emotionality, and fear responses and emotional responses to the environment. Do you agree with that?
Let me say two things about it. The first thing is, and again, this is my background partly as an epidemiologist and partly as an experimentalist, I think you have to be very careful about attributing causality here.
You're absolutely right.
And
yeah.
so I think you're absolutely right that the long-term data on an association are very compelling. On the other hand, where that comes from, related to the complexities of the confounders and the transactional relationship between the behavior of the child and how that affects his environment or her environment. So that's one thing. So you're absolutely right.
That goes back to Mark's comment as well.
Correct.
I'd like to bring that back in.
The second thing I would say is I do think a very important message for the committee is to emphasize the commonalities with other forms of maltreatment, because I think you're right, there are a lot of similarities, but then also to make it clear that this is not just another form of maltreatment, that there is something unique about bullying based on the long-term data, and how to do that is a tough call.
Dr. Craig, did you have any comment?
I think, and I'm not a neuroscience, so I'll just say that starting off. But I think what's important, and it sort of reiterates it, is that there is something unique about these experiences over and above the childhood trauma. And I think that piece is an important piece to focus on because, while many of these children may have a history of early adversity, there are also children who are victimized who do not have that history. And so understanding the unique effects associated with it are important. I think, one of the places where we are going right now is we're running groups for kids who are victimized, and we're looking at changes in the brain pre- and post-treatment, so that we're looking at it from an intervention design perspective to say, are these things that we can change by targeting emotional regulation in children, by targeting their responses to fear, by targeting their responses to threat, by targeting some social skills as well. So I think part of that is the work that also needs to be done. We need to have stronger, not only longitudinal designs, which will always be correlational, but by creating interventions that target these hypothesized mechanisms that would change based on behavioral change. So I think and that is good evidence to give, when that research emerges about, how this can inform practice.
Let's see. Dr. Graham. It's not on, Sandra. Nope.
Here. Oh, sorry. Okay. Wendy, hi. Sandra Graham. Dr. Pine, thanks. So my question is that when both of you talk about the neuroscience, there's a certain, it's a stability. So if you're a chronic victim, you're going to have certain changes in the brain. It's a little bit less clear from what you said, Dr. Pine, with the bully, but certainly with the defenders. But we know in the research that there's a lot of fluidity, that the victim can become the bully, that kids are bullies and victims, and that over time your roles change. And defenders, I think Karen may talk later, certainly the paper that she included in our briefing book suggests that defenders and bystanders, their roles change also. So if there's so much fluidity in an individual's reputation or status at a particular point in time, how can we put that much faith in this neuroscience, which is really quite stable and implies a chronicity? The relationships between the experience of being a chronic victim, or in Wendy's work, a defender, and maybe with the bullying, the brain changes imply a great deal of stability. I would assume, even though you're doing these fMRI studies with cyberball, that's one paradigm. But so I guess my question is, how much faith should we put in this neuroscience when we know these roles are so fluid over time?
Well, so I would say a couple of things. First thing is, I would not assume that particularly the functional MRI measures that we're acquiring, I would not assume that those are particularly stable. And in fact, to the extent that we and others have examined them, they suggest that they're not particularly stable. So I would not, think that things like the response to cyberball are in any way fixed in stone. They're every bit as plastic as the behavior, and in fact, we don't think that the behavior can change without the brain changing as well. So if you think that the phenomenon that you're studying is incredibly changeable, the brain has to reflect that, to the extent that as neuroscientists we believe that behavior reflects the brain, number one. Number two, again, I feel a little bit like a broken record, but I think it is very early days. And I do think the message that Regina and the other speaker gave is the right one, is that there are associations here. We can see something, and that is an important message to put in your report, but it should not be driving what you do because, again, it's early days.
Dr. Craig, did you have any response?
Yeah, I would echo that it is early days. I think there is a fluidity, and this comes to the piece about having to look at the methodology of the different types of studies. And I think, one of the things that when you look at the neuroimaging studies, for example, they have not looked at specific groups. There's only one study in the literature that just came out in 2015 that's looked at chronically rejected kids as a study group. So the question that you ask and the role that it plays in these studies, we simply do not know the answer to that. In the study that we did, they had to have it for, the victimization had to have been ongoing for more than a year, and they were not being bullied at that point in time. So that in this cross-sectional study, we have captured that brain experience at that point in time, but we don't know. You're right, what happened before that moment. So, we don't have an answer to your question is the good academic answer, Sandra.
Dr. Flannery.
Dan Flannery, I'm going to ask probably another unanswerable question. Dan, you brought it up in your sort of comment about pre- and post-associated confounders, and then Wendy, you brought it up with your recent conversation about how does this impact treatment and intervention. So is there, we're sort of at the same point with our preventive intervention strategies with bullying-specific behaviors, which is we do some things universally, but we don't do much specifically for victims or perpetrators. So we focus on all these other associated things like aggression and mental health implications, et cetera. So is there anything from the neuroscience, Wendy is sort of, in my uneducated interpretation, you talked about interventions that go at the amygdala versus interventions that go at the prefrontal cortex in terms of our problem-solving, socio-emotional kinds of stuff. Is there anything that the neuroscience can tell us about where we should be going with preventive interventions here, even though it's early?
There are attempts to base interventions on what we know about neuroscience. Most of them are not applicable to children. So they typically involve things like manipulating the brain using stimulation on the surface of the brain. And those are the things where I think there's the strongest neuroscience evidence to support that. There are other kinds of cognitive retraining things that are based in neuroscience that groups like my own group are doing. Again, I don't think you want to go there, and I do not think you want to be talking about in the area of bullying using neuroscience to design treatment. I really don't think you want to do that. On the other hand, I do think one of the most important things that we can do to move the field forward is to take advantage of the few experiments you can do with children. So I know Regina was alluding to this, the other speaker was alluding to it. I do think it is a really good idea to embed neuroscience-based investigations into treatment studies, either preventative or indicative or for kids who are affected. Because I think that from an ethical standpoint, I think that's the only place where we can really get at causality. And the field tends to benefit a lot from those kinds of experiments. They're incredibly expensive and incredibly difficult to do. And so kind of coming out and advocating for carefully well done studies would be a real service.
Yeah, and if I could just add to that, we are not, and there is not the body of evidence to base anything on the neuroscience in terms of intervention. I also think that we know from the field or the research field of bullying that this is a very complex phenomenon, and we have learned, and there are meta-analysis that support this, that working with individuals is not sufficient. It's not going to bring about big change because bullying is, the most effective bullying prevention programs are ones that take the whole school approach. So changing the individual is only going to lead to limited success. That you have to go much beyond that. You have to change what the peers do. You have to change the norms of the school and the classroom. You have to engage parents. You have to engage community. So that we can use this as one part of a bullying prevention intervention is to focus on working with children who are victimized. But to base it solely on the neuroscience is going to be problematic because the field is too young. We don't know enough, and it's just simply not going to be enough as an intervention to just change these individual kids. That has to be embedded in a whole school approach. So I agree that the best way that we can use neuroscience right now is to use it as a measure, but not to base the content of the intervention.
Thanks. Catherine?
Just to follow up on some of that, there's some work that's going on now by Mark Greenberg and Denny Fishbein that's looking at neurocognitive mechanisms associated with social emotional learning programs. So it's not being tailored per se, but really trying to understand particular focus on executive functioning and emotional reading. So there is some work in that area, but it's more general around aggression with interest and focus, executive functioning, impulse control, those kinds of mechanisms. So there is an emerging literature in that, but it's largely trying to understand mechanisms. And through that, we may be able to understand how we can tailor interventions for kids with certain kinds of profiles of aggressive behavior. But the PATS curriculum, which Mark Greenberg developed, is the particular focus of one set of studies that are going on now. And that's not a bullying prevention program per se, but it's hitting a lot of the other targets that we think are certainly relevant. So there's a broader kind of prevention science interest in neurocognitive mechanisms. And there's also some interest in trauma-informed approaches and things. So I think there's some broad applications of the neuroscience we could bring in, but not necessarily the same kind of tailored and targeted efforts you were talking about in the adult literature.
Thanks.
If I can make one comment about that, I do kind of hear people saying I frequently sound like Debbie Downer. I'm told that, and I got to say I struggle with it because I don't want the message to be that neuroscience is not important. I think it's vitally important. I think the issue is, and you know your comments kind of triggered this. I think we as particularly as neuroscientists interested in humans and children, we have been burned so many times by over-promising and over-hyping. That's where my cautious approach comes in. So,
All right. Why don't we take Dr. Todres' question, and then we'll see if there's any questions from the audience.
This is Jonathan Todres. I may be pushing us a little too far, but and I know you said emphasize these are very early days. But I heard Wendy say that in terms of raising awareness, this research can be very important. But I'm wondering from a law or policy perspective, what we might take. One of the challenges, of course, is as the science is ever evolving, law requires decisions at fixed points in time. And so, what can policymakers take from where we are at in the neuroscience?
well, I think policy and law are two very different things, and I think, at least for myself, I have a higher bar for doing something to the legal system than something for policy. I do think, and I think everybody would agree with this, that the impact on the child from victimizations is substantial. And I think I would view the neuroscience as just another piece of evidence about the burden of the problem. And I think that's probably the best, safest thing that you can say. And from a policy standpoint, I think just the fact that this committee exists reflects the fact that not enough has been done. And I think the existence of the neuroscience literature helps you make that point. My feeling is going beyond that is a mistake. That I wouldn't go beyond that, and I wouldn't see the neuroscience data as any more important than the data on long-term educational outcomes, risk for psychopathology, degree of independence, and all the other bad things that bullying does.
Dr. Craig, do you have any response to Jonathan's question?
No, I completely agree with the last speaker. I think he has nailed it.
Thank you.
Can we go back and address one factor, Mark's comment? I just feel that as a committee member, that I really want to get a better hold on your comment suggesting that maybe there's vulnerability for the victim and that somehow the victim has responsibility for being a victim. And I don't want anybody to get that impression.
Oh yeah, that's a really complicated. Issue to bring up,
Yeah.
and I almost hesitate to talk about it because it will create the wrong impression. Probably the way that I would think about it is that our behaviors tend to evoke things from the environment. And in some areas, that's a very well-established pathway. So for example, kids who are boisterous and rowdy and very eager to do things are more likely to get in accidents. And so when we look at things like accidents, we find that there's a heritable component to the accident, and we think that being overly impulsive and rowdy contributes to that. Now, you might also find that blaming the victim. I don't know that it is or it isn't, but I think you want to think about what a comparable behavior analog would be. And how to do that without, laying fault on the individual, again, it's a messaging point, any more than we lay fault on the individual for getting depression, right? We don't do that. I don't know.
But there is research, if I'm not mistaken, suggesting that any child can become a victim of bullying, suggesting that genes might play a role in some situations, but there are many situations where vulnerability doesn't. Would that be correct?
Well, I think you got to deal with that twin study, and you got to deal with the heritability of bullying of 60%, or of victimization of 60%. I mean, either you say this is one study and we're going to throw it out because there is another study, and and that's, even though that's the best one, either you can do that and throw it out, and then your point is right, or you have to say, okay, how do we understand an environment?
But those studies didn't control for many, many environmental factors.
No. The
placed
whole
into the heritability.
no.
Yeah.
Well, yeah, it's a twin study. So you can criticize a twin study on many grounds.
Yeah.
You can criticize the equal environment assumption. You can say that gene-environment interactions are swallowed in the term for heritability. You can do all of that, but that approach has not worked well for diabetes or schizophrenia. So
I just wanted to insert caution into there. Just as we inserted caution for the neuroscience, we want to insert caution for the genetics. That's all.
I want to just see if there are any questions from the people in the room here, since we only have about 5 more minutes left. Please introduce yourself as well.
Carmen, University of Washington. And I was just thinking about the wonderful studies that Chen has done comparing the transactional analyses of socially withdrawn kids in China versus Canada. And I think it really speaks to that very nicely, since we know that there's a highly heritable element in social withdrawal. And in looking at kids in China, he found that because Chinese, at least at the time of that study, because the Chinese peers view withdrawn behavior as appropriate, polite behavior, that the peers of socially withdrawn kids were very likely to engage those children and speak to them and regard them as really good interaction partners. So we see that even though there is this heritability, there's also that transactional. In Canada, on the other hand, the peers tended to view the withdrawn kids as odd, and they tended to be very demanding, and they tended to bully them more. And over time, the kids became more withdrawn. So I think that really speaks to that interplay between culture and heritability that everyone is really interested in.
I do think that that's a very relevant point and a very relevant study. I think the most relevant place for it to come in is when you talk about any twin study. Twin studies are always constrained by the environment in which they're conducted. And just because, that's the other thing you can say, just because the heritability in this one study was high, we cannot assume that in China, for example, that genes are going to operate the same way. So,
I have a comment from Tracy Viancourt via the webcast. The heritability estimates vary even within studies across time. So at younger ages, the heritability estimate is different than at older ages, and the same children followed over time. This suggests we don't know yet, and the area needs to grow up.
Thank you. Okay.
Yeah, okay.
Any other questions from the people in the room? Were there any questions on the WebEx?
No, not so far. If you have questions on the web via the webcast, please type them into the comments box.
Okay, I guess we have time for another question or two from our panel then, or committee. Any other questions? Catherine, I think you had something that you wanted to say earlier and I cut you off.
I was just kind of going back to Regina's comment about the victim piece, but we do know that kids aren't randomly chosen for victimization, particularly when we get into chronic patterns of victimization, that there is kind of moving in, particularly on kids that have problems with emotion regulation. And so it's a little bit of this kind of confounder. Kids that are going to have emotion regulation problems are going to be more likely to be targeted and thus more vulnerable. So it is a bit of a cycle, and there are probably genetic profiles that would make kids more likely to have dysregulated patterns of emotion regulation. And so, you know, it is a complex dynamic that it's not, bullying may initially be kind of an equal opportunity thing, but when you start getting into the repeated cycles and the chronic victimization, it's hard to tease out the cause versus the consequence because it can really make things worse. So I think there is certainly some utility in looking at vulnerability for victimization, but with all the major caveats that you say. So that way it isn't just that these kids are more likely to be victimized, but they may be also more likely to exhibit problematic outcomes associated with that victimization.
Any other questions? Okay. Well, with that, I want to thank particularly Wendy from joining in from Canada, and Dr. Pine for coming over from Bethesda to join us. And so we'll take now a 15-minute break and reconvene at 15 minutes before the hour. Thank you.